Hi, I'm Dr. Brian Berger. Thank you for coming to my website. I'm just going to lay out a few quick principles, I guess, some of the factors that we use when we're working with our patients in our clinic. If you've got pain of some kind, let's say you've got elbow pain or numbness in the toes or numbness in the fingers, we like to open up what are essentially the neuromuscular structures. So the muscles and the nerves that empower those muscles and the other soft tissue structures that would normally make you running smoothly. And if they are not making you run smoothly, then there's something wrong with the soft tissue structures that drive your neuromuscular system. The neuromuscular system, by that I mean everything you would see here, everything that drives and supports the spinal column. Because what happens is, and this happens to everybody who has any level of activity whatsoever, we get a tiny little tear in our muscles. At some point in our lives, we all do. And that tiny little tear in our muscles and our soft tissue leads to an immobility at a level such as this one here in the tiny little muscles between these 2 points or between these 2 points. And these tiny little muscles are so small that what happens is they can't actually be stretched out on our own, even if you are doing a pretty active stretching program. And this is just an example. I mean, this is the lumbar spine, but it could be anywhere in your body. You can tear muscle between your ribs or in your shoulders and your elbow, and they have to be rehabbed back to their appropriate health. And what happens is we try to do stretching programs or we try therapeutic programs that may not work. I'm going to tell you what I think is a sort of an advantage to what we do in our clinic. What I do in my clinic, as well as give you a really powerful neuromuscular rehab program for home training, as well as doing myofascial release and all the other releases that we need to do with the muscles on the peripheral areas, for example, on the elbow, wrist, leg, knee. We also get into the deeper spinal muscles that are, some research would say, impossible for you to actually stretch out on your own. They are the interspinous and intertransversalis muscles. And if they are too wound up, what happens is you end up walking around with what they call an asymmetry. So you end up being crooked. In other words, you walk around just like that. And that asymmetry, what that asymmetry does is, yes, immediately you can see it may create an irritation onto a nerve. So immediately you may get that. So you might be as young as, just a kid and getting a trauma, and then you end up getting the symptoms of a pinched nerve. You may not feel that pinched nerve right at your spine. As you can see, these nerves go all the way down, and they run all the different aspects of our body. So you might have a pinched nerve and feel numbness in the hand, or a pinched nerve and feel numbness or soreness in the elbow, or a pinched nerve and feel a stiff, tight shoulder that doesn't work. It's very tough to differentially diagnose between these things. So obviously we work on both aspects if there's a peripheral issue, an arm or leg issue. But the big deal, the big problem in our health and in our life is that often this problem here at the spinal level has never really been found or diagnosed or treated. And so when I meet people often, especially if the young patients are an easy fix, but as you get older, if you've been walking around with an asymmetry for 25 years, and it happens almost all the time, almost every one of us has been walking around with an asymmetry for a certain amount of time. An asymmetry is essentially when you have, like I said, this imbalance of musculature, creating this asymmetry onto this intervertebral unit here. What you're going to have is you're going to have a greater load on this hunk of cartilage than you do on the rest of the cartilage of your spine. And when that cartilage wears down, when that hunk of cartilage wears down, we call that the degenerative cascade, and that degenerative cascade is diagnosed as one of many things, usually a bulging disc, a herniated disc, spinal arthritis, degenerative disc disease, degenerative arthritis. These are like 5 major terms that would describe the same primary issue. And the primary issue being truly a functional issue. And that functional issue is just this. You are walking around with an asymmetry, and somebody has to restore you to symmetry and take the pressure off that disc. So that's where we really shine in our clinic. We use a flexion distraction table, which is a table that's designed to allow me to stretch these very deep spinal muscles that you cannot stretch on your own. It is between difficult and impossible, depending on the researcher, for you to stretch this out on your own. So why do we do this? Well, because arthritis is the #1 cause of immobility. Arthritis of the spine especially will be your #1 battle as you age to maintain mobility and to maintain strength. So if we can't battle that effectively, then you're going to quickly become immobile and quickly become reliant on medications to reduce pain. Whereas really your best bet is to actually combat the problem. And the way we do that is, of course, we do full examination, x-rays, and history, as you would expect, to determine what your issues are. And a lot of times the symptoms can point us right back to where the problem is. We'll find out where you might not be functioning as well as possible in terms of your neuromuscular system, and getting you to be stronger in that area. So of course, number one, in terms of in-clinic treatments, so we find the area, diagnose the problem, we find out where you're asymmetric, and we actually stretch out these tiny soft tissue structures. They are muscular, they are cartilaginous, they are joint capsules, they are soft tissue structures that we need to professionally stretch for you in the proper form so that you can go from this asymmetry back to a level of symmetry. And also on top of that, we're able to actually decompress the intervertebral joint capsule for the intervertebral disc, allowing that joint capsule to fill up with fluid. And by doing so, we actually can increase the height, or the apparent height, of the intervertebral disc, and this gives you better function. This allows for the nerve to flow more freely. This allows to take irritation away from the nerve, allows you to have, I suppose you could say, greater strength and greater reliability of this area. But then you add on another sort of a layer of therapy, and that is just your home program, which we designed for you, with you, in which you are essentially trained how to re-engage these soft tissues that have been torn. So once we restore them back to their proper length or mobility as well as we can, if you are also engaging them, then they become a part of your central nervous system, starts to notice and use these muscles and these soft tissue structures again. Because if they've been riddled with scar tissue, your body has been ignoring and not really using these tissues. Your body's been cheating and using the disc instead. So when we bring these soft tissues back to life, back to health, with in-clinic treatments as well as your home neuromuscular rehab training that we put you through, you end up having like a big change, not just a change in health or pain, but an increase in energy usually, and an increase in, you basically become more, I don't know what the word is, more confident in your own body, in your own back, that you can actually do things because you can actually stand for long periods of time, and because you actually have like a home stretching and strengthening program that works, which we design with you. And also they have a physician, a chiropractor, that can actually restore function to you when your balance is so off that you actually need that help. So that's a good introduction to what we do. I'm hoping to post a website or a video right away about showing you the actual treatment that we do. You can email me anytime, or even text me anytime. My email is drbourdeur@gmail.com, doctorbroudeur@gmail.com, or just text me. The numbers all over the site, 7809374325. I'll answer any questions, help you as much as I can. Thanks again for coming to my website, and I hope to hear from you soon.